So today we're going to be talking about projection with breast implants. Here we have a low profile or low projection breast implant, moderate, full, and extra full or extra high. And depending on which projection of breast implant you choose, they'll give you a completely different look. So let's compare them in today's video so we can see how you can select the right projection for you. If you're new here, my name is Dr. Riaz Agha and I've completed well over 10,000 operations, including many breast augmentation surgeries for my patients. If you have a look at these breast implants, you can see just how much they're coming off the desk here. And as we're going along, they're coming up more and more and more and more. And the actual diameter of them is actually pretty similar. So you can get an implant which has got exactly, for example, 12 centimeters across, and they can all be 12 centimeters across, but they've got different projections. And that means they've got different amounts of volume, or cc's is how we'd measure it. Now, when you actually place them on, you'll see that the projection is just how much they're coming out of the chest forwards. So as you go up, you will have more and more projection. And that projection is something that we measure, and we can see, okay, what would be appropriate for a patient? What are they looking for? What are their goals? So the projection that we choose is going to be directed by the goals, but also directed by the patient's anatomy. For example, could you fit an implant this big in? Are they going to have enough skin and soft tissues for you to accommodate it? If not, then you can't really place this one. You may have to choose something that is more in line with what they can fit in their pocket, or the pocket that you will create as a surgeon. So what are the advantages or disadvantages of different projections? Well, you want to get the right kind of volume for what you want. So if you are a C cup and you want to be a double D, then this probably won't take you there because it's just not enough volume. So a low projection would be good for somebody who just wants to add a small amount of volume. They just want a little bit of extra fullness at the upper pole. They want a small amount of volume increase. They're not looking for much, and that's who that would be appropriate for. The advantage of it is that it's quite light. Less volume means it's less weight and it's quite light, and that means that you're not likely to get sagging or ptosis over time where the envelope can stretch down and you're going to need an uplift in the future when you do a further breast augmentation in, say, 12 or 15 years. So that's the advantage. They're very light. As you go up to the next projection, the weight increases a little bit and you're going to get more volume and more projection. So if your goal would be to go up a couple of cups, you may be looking for a moderate increase in projection. And of course, cup size is going to be determined partly by what you've got, and it's what kind of bra you already wear, and that is going to be a very individual decision. If you go on to the full projection, this will be where somebody's looking for, say, 3-cup increase, something like that, just speaking approximately. That's where you're looking for, and you're going to have enough volume of soft tissue to accommodate a full projection. One disadvantage is, of course, that you're now getting heavier, and as you get heavier, there's going to be placing pressure on the lower pole, and that can make it stretch over time. There are certain techniques that we can do to try and reinforce the lower pole. We can try and improve and accommodate and give more resistance to that stretch with what we do. But if somebody has very thin skin and thin soft tissues, there's going to be a degree of instability there over time. Very important that you wear a bra to support the breasts. And as you go to the largest projection, extra high, extra full, or corset, depending on whatever the brand calls it, more projection, but also more weight. And this would be often somebody using this, maybe somebody who's stepping up from one of the earlier breast implants that they've got, and they're looking to get an increase in size. They've developed the soft tissues over time, they're looking to go bigger, and they simply want that increase in size from where they already are. They typically would have probably breast implants already. Or they may have a lot of spare soft tissue from previous pregnancies, weight gain, weight loss, and they've got the loose soft tissue envelope to accommodate such a big implant. Disadvantage, of course, is weight over time. So just to wrap up, the most common projections that I utilize for my patients are moderate, followed by full. These are the ones that I have the most of in the clinic where people can try them on, because typically we don't as often go to the more extremes of size, but I do have them, we do use them, and they're probably applying to about less than 10% of women, but probably around 5% of patients would be going towards these categories of projections. The 95% would be really in the sweet spot of moderate and full, with the majority of those probably being the moderate projection that we use. So that was my overview of projections in breast augmentation. Look forward to seeing you on the next video.